Heart disease doesn't always shout. It whispers. And too often, we miss the signs until it's too late. It's the same silent threat that took icons like Carrie Fisher, James Gandolfini, and Reggie White. Gone too soon, despite the fame and resources they had. If it can happen to them, it can happen to anyone. In this video, we uncover 5 overlooked signs that your heart may be in trouble, and what simple steps you can take now to protect yourself. Don't guess. Don't wait. Stay with me through the end, because what you learn today could change the course of your health tomorrow. But first, if you're finding this video helpful, please give it a like and type 1 in the comments below. It motivates me to keep creating content like this for you. Let's begin. The first sign is shortness of breath. Many older adults begin to notice that they're getting out of breath more easily than before. Maybe it happens when walking across the room, climbing a few steps, or bending over to tie their shoes. For some, it can even occur while they're just sitting still or lying in bed. It's easy to dismiss these changes as just part of getting older, but shortness of breath can actually be one of the earliest and most important signs of heart failure. So what exactly is going on? When the heart begins to weaken or doesn't pump efficiently, it struggles to move blood through the body. This can cause fluid to build up, especially in the lungs. When there's fluid in the lungs, breathing becomes harder. Even simple movements can start to feel exhausting. You might feel like you just can't catch your breath, or that you're breathing faster than normal without any reason. For many seniors, lying flat in bed becomes uncomfortable. They find themselves needing 2 or 3 pillows just to sleep without feeling like they're suffocating. That's not normal aging. It's a signal that the heart needs help. It's important not to ignore this sign, especially if it keeps coming back or gets worse over time. The good news is there are ways to manage it and feel better. One simple adjustment is changing the way you sleep. If lying flat makes you feel breathless, try sleeping in a more upright position. Use a few extra pillows or consider a wedge-shaped cushion to gently raise your upper body. This can help reduce the pressure on your lungs and make breathing easier during the night. Another helpful step is learning to pace yourself. Many people push through the discomfort, thinking they just need to build more stamina. But when the heart isn't pumping well, rest is just as important as activity. Break up your day into small tasks. Sit down while folding laundry or cooking. Take short walks rather than long ones, and pause often to catch your breath. It's not about doing less. It's about doing it smarter and giving your body the support it needs. You can also make changes to your meals that help reduce fluid buildup. Eating smaller portions throughout the day, rather than large, heavy meals, can ease pressure on your chest and lungs. And it's crucial to limit salt in your diet. Salt causes your body to retain water, which increases swelling and makes breathing more difficult. Start reading labels and choose low-sodium options whenever possible. Simple changes in what you eat can make a noticeable difference in how you feel. Medication may also play a key role. Your doctor might prescribe diuretics, also called water pills, that help your body release extra fluid. This reduces the strain on your heart and lungs. Some people find significant relief just from staying on top of their prescriptions. But these medications work best when combined with good daily habits and careful attention to symptoms. Most importantly, don't wait until shortness of breath becomes overwhelming before seeking help. Early action can slow the progression of heart failure and improve your quality of life. If you feel like you're gasping for air during normal tasks, or if sleeping flat is becoming difficult, talk to your doctor. Describe your symptoms clearly. You deserve to breathe freely and comfortably every day. Let this be your reminder. You are stronger than your symptoms. Every time you choose to listen to your body and take steps to care for it, you are investing in a healthier, more independent future. You're not giving in. You're taking control. Now that we understand how breathlessness connects to heart failure and what we can do about it, let's move on to the second early sign that often hides in plain sight. A deep, persistent fatigue that doesn't go away with rest. The second sign is fatigue. Another sign that often goes unnoticed or brushed off is fatigue. Specifically, a kind of deep, lasting tiredness that doesn't go away with rest. Many seniors describe it as feeling like their energy is just drained even after sleeping well or doing very little during the day. You might wake up already tired, or you might feel worn out from simple activities like getting dressed, making breakfast, or taking a short walk to the mailbox. This kind of fatigue is different from being sleepy. It's a heaviness in the body and mind that doesn't improve with a nap or a good night's rest. In the context of heart failure, this fatigue happens because the heart isn't pumping enough oxygen-rich blood to meet the needs of your muscles and organs. Without enough fuel, your body starts to conserve energy wherever it can. That means you'll feel slower, weaker, and less motivated to move, even if you're normally active and independent. Your arms may feel heavy. Your legs might tire quickly. Even conversations might feel like too much effort. It's easy to think this is just what getting older feels like. But when this kind of fatigue is new, worsening, or getting in the way of your daily life, it could be your heart sending a warning. And just like with breathlessness, there are practical steps you can take to manage it and regain some of that lost energy. Start by learning how to budget your energy. This means looking at your day and planning activities with breaks in between. If you have errands to run, spread them across the week instead of trying to do everything in one day. Take time to sit down and rest often. It's okay to say no to tasks that push your limits. Allow yourself permission to move at your own pace. Nutrition also plays a role. When your body is tired, it's easy to skip meals or choose foods that aren't nourishing, but eating well-balanced smaller meals throughout the day can provide steady energy without overwhelming your system. Choose foods rich in fiber, protein, and healthy fats. Stay hydrated, but be mindful of how much fluid your doctor recommends, especially if you're on a fluid-restricted plan due to heart failure. Light movement can also help restore energy over time. It may feel counterintuitive when you're exhausted, but gentle activities like slow walking or chair exercises can improve circulation and build stamina. Even 5 to 10 minutes a day can make a difference. Just listen to your body and avoid pushing yourself to exhaustion. Of course, always talk to your doctor about new or worsening fatigue. Sometimes medications may need adjusting, or further testing might be needed to see how well your heart is functioning. It's better to be safe and proactive than to wait until symptoms become more serious. And above all, don't let fatigue steal your sense of purpose. You still have goals worth reaching, people who care about you, and things to look forward to. Remind yourself, even on the slow days, that your effort matters. Taking time to care for your heart isn't slowing down. It's choosing to move forward wisely. The third sign is swelling. One of the most visible signs of heart failure, yet often overlooked, is swelling, especially in the feet, ankles, and lower legs. Many seniors notice that their socks leave deep marks or that their shoes feel tighter by the end of the day. Some even see their legs puffing up, feeling heavy or stiff. At first, it might not seem serious. Swelling is easy to blame on hot weather, standing too long, or even diet. But when it becomes a regular pattern or starts getting worse, it could be a sign that your heart is struggling to do its job. This type of swelling is called edema, and it happens when the heart isn't pumping blood effectively. Blood starts to back up in the veins, especially those in the lower part of the body. At the same time, the kidneys may respond by holding on to more fluid and salt, which only adds to the buildup. Over time, this extra fluid settles in the soft tissues, especially in the legs, ankles, and feet, because gravity naturally pulls it downward when you're sitting or standing. You might first notice it when your shoes don't fit like they used to, or when your ankles seem to disappear into puffiness by the evening. The skin might look shiny or feel tight to the touch. In more advanced cases, the swelling can spread to the thighs or even the abdomen. If you press your finger into the skin and it leaves a dent that takes time to go away, that's another clear sign of fluid retention. But you're not helpless against it. There are simple ways to manage swelling and help your body handle fluid more effectively. First, try elevating your legs above the level of your heart a few times a day. This helps the fluid move back toward the upper body, where the heart and kidneys can process it. You can do this by lying down and propping your legs up on pillows, or resting them against a wall for a few minutes. Wearing compression stockings is another effective solution. These special socks gently squeeze your legs and support your veins, helping prevent fluid from collecting in the lower parts of your body. Your doctor or pharmacist can help you choose the right type and size. Most importantly, be mindful of your salt intake. Even small amounts of extra salt can cause your body to hold on to water. Start reading labels and avoid canned soups, packaged snacks, and processed meats, which are often loaded with hidden sodium. Cooking at home with fresh ingredients gives you more control and supports your heart health. Also, don't forget to weigh yourself regularly, preferably every morning after using the bathroom and before breakfast. A sudden gain of more than 2 or 3 pounds in a day, or 5 pounds in a week, could mean fluid is building up in your body. It's a simple habit that can alert you to a problem before it becomes serious. And always check in with your doctor if the swelling worsens or spreads. You might need medication adjustments or further evaluation. Swelling may seem harmless at first, but in the context of heart failure, it's your body's way of asking for help. Remember this: even small steps can lead to big changes. Paying attention to what your body is telling you and responding with care and action can help you feel more in control, more comfortable, and more capable each day. Next, let's talk about a symptom that might feel alarming but is often ignored until it becomes disruptive. An irregular or rapid heartbeat, something that can signal your heart is working too hard just to keep up. The fourth sign is a rapid heartbeat. Another important sign of heart failure, One that many people experience but often overlook is an irregular or rapid heartbeat. Some describe it as a fluttering feeling in the chest, like a bird flapping its wings. Others feel sudden pounding, skipping beats, or even a racing heart for no obvious reason. These moments may come and go quickly, or they may linger, leaving you feeling lightheaded, weak, or anxious. If you're noticing unusual heart rhythms, it's not something to ignore. It could be your heart working overtime to make up for lost strength. In a healthy heart, the rhythm is steady and consistent. But when heart failure sets in, the heart sometimes tries to compensate for its reduced pumping power by beating faster or irregularly. This is the body's way of trying to keep enough blood moving, especially to vital organs like the brain and kidneys. The problem is, these irregular rhythms, also known as arrhythmias, can put extra strain on an already weakened heart and make symptoms worse over time. Sometimes these changes feel dramatic, like your heart is pounding out of your chest after climbing the stairs. Other times it might be subtle, a skipped beat here, a flutter there. You might even notice that you're more aware of your heartbeat when lying down or trying to fall asleep. In some cases, an irregular heartbeat can cause dizziness, shortness of breath, or fainting spells. All of these are signs that your heart rhythm may be off, and your heart could be under pressure. So what can be done about it? First, try to stay calm when you notice your heart acting differently. Anxiety and stress can make irregular heartbeats worse, so take slow, deep breaths and rest until the feeling passes. Track when it happens, how long it lasts, and what you were doing at the time. This information can be helpful for your doctor. Lifestyle adjustments can also reduce episodes of irregular heartbeat. Limit caffeine, found in coffee, tea, sodas, and even some medications, as it can trigger palpitations in sensitive individuals. Try to get enough sleep. Avoid large, heavy meals late at night. And manage stress through gentle routines like stretching, listening to calming music, or short walks in fresh air. Exercise, in moderation, can also strengthen your heart and improve your rhythm over time. Even light activities like walking, gardening, or seated leg lifts can help your heart stay in sync. But always speak to your doctor before starting or changing an exercise routine, especially if you've had symptoms like dizziness or chest discomfort. In many cases, medications can help regulate the heartbeat and prevent complications. These might include beta blockers or rhythm control medications, depending on your condition. Some people may need further tests like an ECG or heart monitor to determine the exact cause and find the right treatment plan. You should never feel embarrassed or afraid to talk about changes in your heartbeat. This is your body's way of telling you it needs support, not silence. You deserve to feel steady, secure, and safe in your own skin. Let this be your reminder. Peace begins with awareness. When you learn to listen to your body's signals without panic, you give yourself the power to respond wisely and with purpose. Now, let's move on to the fifth and final sign in this guide. Frequent nighttime urination, a symptom that might not seem related to the heart at all, but actually holds important clues about how your heart is functioning behind the scenes. The fifth sign is frequent nighttime urination. Let's now talk about a symptom that catches many seniors off guard: frequent nighttime urination. Getting up once during the night might not raise an alarm, But when you find yourself waking up 2, 3, even 4 times to use the bathroom, it starts to disrupt your rest and your overall well-being. What many people don't realize is that this isn't always about bladder problems. In fact, it can be a sign that the heart is struggling to manage fluid properly, a lesser-known clue of heart failure. Here's what happens. During the day, if your heart isn't pumping well, fluid tends to build up in your lower body, especially in your legs, ankles, and feet. But when you lie down to sleep at night, gravity no longer pulls that fluid downward. Instead, the fluid re-enters the bloodstream and heads toward the kidneys, which then try to remove it through urination. That's why you might find yourself needing to go to the bathroom more frequently once you're in bed, even if you didn't drink much fluid in the evening. This repeated waking has more consequences than just sleep disruption. Poor sleep can worsen fatigue, affect your mood, and reduce your energy for the next day. It can also raise blood pressure and strain the heart even more. So, frequent nighttime urination isn't just a minor inconvenience. It's your body trying to deal with a larger issue involving circulation and fluid overload. There are a few ways to manage this symptom and help your heart work more efficiently. One of the simplest is to elevate your legs during the late afternoon or early evening. This encourages fluid to move from your legs into your bloodstream earlier in the day, giving your kidneys a chance to process it before bedtime. Just resting with your legs propped up for 30 to 60 minutes before dinner can help reduce how often you need to wake up later. It also helps to be mindful of your fluid intake, especially in the hours before bed. That doesn't mean cutting fluids completely. Hydration is still important, but try to finish most of your drinking earlier in the day. Avoid large amounts of water, tea, or soup in the evening. Also, watch for hidden fluids in foods like watermelon, broths, or juicy fruits close to bedtime. Don't forget that medications might play a role too. Some heart failure medications, especially diuretics or water pills, are designed to flush out extra fluid. If you take them too late in the day, they can keep you running to the bathroom at night. Ask your doctor if adjusting the timing of your medication could help reduce nighttime trips without affecting your overall treatment. Lastly, track the pattern. If you're waking up frequently, note how often, what time, and how much urine you're passing. This can help your doctor pinpoint whether the cause is heart-related or if another condition, like prostate issues, diabetes, or kidney function, might be involved. Most importantly, don't brush it off as just a normal part of aging. While it's common, it's not something you have to accept without question. Sleep is vital to healing, energy, and emotional balance, and addressing the underlying cause of frequent nighttime urination can help you rest easier and live more fully. Let this thought stay with you. Even in the quiet hours of the night, your body is speaking to you. The more you listen, the more you learn, and the better you can care for the heart that's been carrying you through life all along. Your heart has carried you through decades of memories, milestones, and moments that matter. It deserves care, attention, and respect, not fear. Every small step you take toward understanding your body is a powerful step toward protecting your future. You are not too old, and it's never too late to take control of your health. Stay curious, stay consistent, and most of all, stay hopeful. Because every heartbeat is a chance to live better, longer, and stronger. You've got this, and you're not alone on the journey. Don't forget to subscribe to our channel and click the bell if you don't want to miss any important health video like this just for you.